Alrighty, if you want to go ahead and get started, we're good to go.
Great, thank you. Hi, everyone. Thank you so much for joining us this evening. And thank you to the SUNY Student Assembly for inviting me to speak to you today. My name is Emily Kadar. I am the Director of Women's Affairs for Governor Andrew Cuomo. In that, I wanted to sort of use this opportunity to both tell you a little bit about my office and the work that we do, and then also talk more specifically about what has been happening, obviously, with the COVID situation, and how in particular that has been affecting New York women and girls, and what the governor is doing to combat some of those issues, and sort of what you all can do to continue engaging in the important work that I know you are all doing on gender equity. And so just to sort of start out and give you a little bit of a base of understanding as to who I am and why I'm talking to you tonight. So like I said, my name is Emily. I am the Director of Women's Affairs for the governor. And what that basically means is that I am the person within the governor's office who is an advocate for women's issues, for gender equity issues. I am the person who is the liaison with all of the different people and the different interest groups throughout the state who work on women's issues, which obviously is like a huge, just like a giant universe of issues. I also keep an eye on all of the different policy pieces that are related to women and gender. And so it's a really interesting portfolio because that crosses a lot of different subject areas. I work with a lot of different secretaries and folks within the administration councils that work on different issues. But one of the best parts of my job is I work with the New York State Council on Women and Girls, which is a body that the governor created in 2017. It is chaired by Melissa DeRosa, who is the secretary to the governor, which is pretty much like his top advisor. And the Council on Women and Girls is a standing body, a group of both all of the different commissioners throughout the government. All the different women commissioners are part of the Council on Women and Girls, but also there is a steering committee of leaders in business and advocacy and different cultural issues who all lend their voice and give advice to the governor and his staff on what are really the most important issues affecting women and girls throughout the state. Every year, the governor issues a women's agenda, which is part of his State of the State address. It's part of his budget proposal that he puts out every year. And I feel very fortunate to live in a state where the governor is willing to make issues related to women and to gender part of his regular agenda. And it's not just like a thing that he does sometimes, but it is a permanent part of the work that he does. It's something he deeply believes in. It's something that he takes very seriously, which is why the Council on Women and Girls is so effective, because they are taken seriously and they have been behind some of the biggest policy wins that we have had in this state, from the Reproductive Health Act to equal pay laws to transforming our domestic violence response. We have had so many amazing acts of progress over the last few years in our state. And I really give a lot of credit to both the folks within the administration who have been championing this and making sure that it rises to the top in a large pile of competing priorities, but also to the advocates who are on the ground. And I include SUNY students who have been, and CUNY students who have been some of the strongest champions for a range of issues, whether it's sexual assault or Title IX, or all of the different things that affect New Yorkers at every level across our state. And so just wanted to give you that sort of background. I'm actually fairly new to the administration. I started in December. Before that, I spent over a decade, over actually over 12 years as an advocate. I worked in reproductive health and rights. I worked in gender equity and feminist issues. So I am like new to being in government, and instead of being on the outside and leading the protest outside. So it's been a really interesting change for me, and a really good place to be after so many years of working hand in hand with the governor and his team. To be on that team is really exciting for me. So anyway, moving on from that background, I do want to give you all sort of both a big picture look at how COVID-19 has specifically impacted women, and then also talk a little bit, get into the nitty gritty of what the governor has been doing specifically to deal with some of those issues. And I think it's really important that we have this conversation, and it's one that I think we're going to have to keep having, not just about women in general, but about the way that COVID-19 has really impacted a number of different constituencies, a number of different groups. Obviously, when we say how has it impacted women, I mean, that's like a huge general category, and there's a lot of different ways that we can parse that information and talk about people's intersectional experiences and their lived experiences dealing with this. I think that we know that COVID-19 has affected different communities in different ways, and it has sometimes and actually consistently exacerbated existing social differences and marginalizations and injustices. For me, that's what I have just been continually learning through this process. Is I think it's really revealed how our social safety net is very, very delicate, and a crisis like this can really rip it apart. And that's why it's so important that we continue to fight for those who are most affected by this crisis, and make sure that we emerge out of it stronger, which I know that we will, because we are New Yorkers and that is what we do. And that's not just bluster, talking about like the New York tough thing. It's really this, while this is a horrible situation, we are going to emerge from it stronger. And that is what we're trying to do very hard. So I want to talk a little bit about that disproportionate impact. Women make up a huge percentage of the essential workers who have been really impacted by COVID-19. 52% of essential workers are women. These are nationwide statistics that were reported by the New York Times, but 77% of healthcare workers are women. 2/3 of grocery and fast food workers are women. And when we say women in this instance, we also know when we look at the gender data and the racial data on top of each other, we're really talking about majority women of color. 5.8 million people nationwide have jobs in healthcare that make less than $30,000 a year annually. And of those, 50% of them are non-white, 83% of them are women. So we know that it is mostly women of color that are dealing with the burden of being an essential healthcare worker who is also not necessarily making a lot of money. 9 out of 10 nurses are women, pharmacists are women, respiratory therapists are women, nursing assistants are women. So when we are applauding our essential workers, that's who we are really applauding. We're talking about women, and in particular women of color, who have really made an extraordinary sacrifice to keep New York running, to keep New York healthy. And I just think it's really important that we are very specific when we talk about that. But one other thing I wanted to say in regards to this is I think that when we are looking at these essential workers, we also are thinking about what are the other stresses on them beyond just the stress of going to work during this crisis and dealing with that. But one of the things that I've been thinking about a lot, and I know the governor is thinking about a lot, and his team and his advisors, is childcare. Because obviously, if you're an essential worker, you need someone to be watching your kids, so you can go do that work. I think people across different socioeconomic um, statuses have been dealing with childcare issues. I'm sure that there are SUNY students right now who are dealing with childcare issues while they're trying to go to school from home. And so childcare is going to be a big part of our discussion, both around the immediate COVID response and then also our long-term recovery. I put this up because tomorrow is actually Childcare Provider Appreciation Day. So this is a little graphic from OCFS, our Office of Child and Family Services. That is the department in our government that regulates childcare. Childcare is something that already was an issue that we were really having to grapple with. I think it's no secret to anyone that childcare is a challenge for many families in New York. We are actually have, for the last year, there has been a childcare availability task force that is made up of childcare providers and experts in childcare policy, that are looking at this issue from both a provider perspective and a family perspective, a parent perspective, and trying to figure out what New York can do to move things forward. And I think that as we look at our reopening, as we look at the New York Forward plans that are going to be these regional reopening plans that the governor has been talking about a lot. How can we reopen the state safely in certain regions? What do we need to do that? And then what do we need to actually make that successful? Childcare is a big piece of that. There's a lot that we still don't know. I use this expression a lot, but we are flying a plane while we're building a plane. And so we're trying to have these conversations while also thinking, okay, so our summer camp's going to be open this summer. Our childcare providers going to have enough seats available to meet the need? And then also, are they going to be able to open safely to allow for enough social distancing? They may not be able to have as many children in their facilities as they might typically have. Are their staff going to be able to come back and feel safe in those environments? So that's something that we're talking about both within the task force, but I think all of the different New York Forward regional groups are going to be discussing what they need to reopen their regions. Childcare is going to be a big part of that. We've also been dealing with the immediate crisis in a few different ways. One of the things that we've done is we got $163 million in federal CARES Act money, and 30 million of that has already been distributed by OCFS towards essential workers who need childcare. If an essential worker's family makes less than 300% of the federal poverty line, which is about $78,000 for a family of four in annual income, they can get a scholarship towards childcare services. That money has also been used to provide some supplies to childcare providers to make sure that they have the supplies they need to open safely. And we're just continuing to look at what are the different paths and how can we make sure that essential workers have the care for their children that they need right now, and then also how are we able to reopen the government later, the economy later. Want to move on to another topic that really has been on a lot of people's minds, and that is combating gender-based violence, especially in the time of COVID. So in New York, we have the Office for the Prevention of Domestic Violence. We are the only state in the nation that has a cabinet level office committed to preventing domestic violence, which is something that I am personally very proud of as a New Yorker. We also have a ton of different sexual assault prevention programs and folks that are really trying to confront sexual violence and gender-based violence in all of its forms. So we know that the situation has made an environment that really has the potential to increase domestic violence. We've gotten reports that there has been a 30% increase in domestic violence reports from this time last year. So from April 2019 to April 2020, there's been about a 30% increase. That said, I don't like to dwell on that number too much because I think that any case of domestic violence is too much. We can talk about statistics and we can talk about numbers, but really we want to make sure that anyone who is in an unsafe situation, anyone who is facing intimate partner violence or abuse or control, should be able to get out and be safe. And so one of the things we've done is we've established a text line. So we already had a call number. We already had a phone number that people could use to access remote counseling through their local domestic violence or sexual assault programs, which is that center one on the screen. But now we've established a text line, which has a human on it 24 hours a day, 7 days a week, an advocate who has been trained through OPTV staff. Many of them are staffing those lines because we know that while a phone number is great, if you are stuck in the house with an abuser, texting is going to be a lot more effective than being able to call. If you're not able to get out to work, if you're not able to go visit family, have that respite where you might be able to safely make a phone call, text is really valuable. We also have a confidential chat line through the OPDV website. And all of these services are available 24 hours a day, 7 days a week. OPDV is also distributing flyers to places where people may be able to go during this shutdown period. So grocery stores, pharmacies, hardware stores, the places where people may be able to see these. And so these flyers are being distributed to those kinds of public spaces in hopes that getting the message out to people who may need it. So they know that even though we are in this in the shutdown, even though the New York State pause is in effect, they can still seek services and that those services are absolutely still available to them, and that no one should have to remain in an unsafe situation because of our current public health crisis. And we're also continuing to connect folks to local resources. For example, this is actually the SUNY site for anyone who is dealing with sexual assault, domestic violence, dating violence. You can still seek services through your local site, which for many of you would be the SUNY resources. And then finally, before I close, I want to talk a little bit about what we've been doing in regards to reproductive health care. This is my background and something that is very important to me and I know is very important to many of you. But one of the main messages that I have been wanting to get out is to make sure that people know that sexual and reproductive health care services are considered essential services. There have been other states around the country where anti-choice lawmakers took advantage of the moment and this crisis to actually further restrict access to abortion, to birth control, to all the different services that people need to access in order to be safe and healthy. And so in New York, we have been very clear that family planning services, your ability to get a birth control prescription, STI testing, abortion services, all of those things are essential. They're time sensitive, and you are able to access that care even under the current crisis. And so that is, I think, a real difference of New York from some of these other places. And I think it's an important thing that people know that they know that you can still go to your local Planned Parenthood, your local family planning clinic, and get the sexual and reproductive health care services you need. In many cases, via telehealth, there's some ways that you may not have done before, but those services are still available to you. We also have been doing a lot of work around labor and delivery. So we know that there was a lot of confusion and actually a lot of fear and frustration on the part of pregnant and laboring individuals who were for at different points when this was first happening, told that they couldn't have a partner with them while they were in labor, while they were giving birth, who were unsure about the capacity of their local hospitals. And so the secretary to the governor, Melissa DeRosa, convened a task force, the COVID-19 maternity task force, that very quickly met and talked about what we can do in New York to make sure that people who are pregnant, are giving birth, are able to do so in the safest way possible with the most choice possible. And so that task force put forth a few different recommendations. The governor accepted those recommendations and issued executive orders and guidances in order to put them into action. So we are now, we have created a process to expedite the approval for opening additional birth centers when needed. So those are sites that are outside of a hospital where someone would be able to give birth safely under medical care by a doctor or a midwife. We have made clear that everyone who is giving birth should have access to a support person, and that support person is, in addition to, if they are using one, a doula. So a doula is not considered a support person that like fits their one person that they get, but that's a part of their care team. We're also advocating for universal testing of pregnant patients, so we can know if a pregnant person has COVID, and then act accordingly. Ensuring equity, making sure that hospitals and other birth sites have equal access to personal protective equipment, that they have the what they need in order to create safe environments, and that there shouldn't be a difference between a public hospital and a private hospital or a birthing center in terms of how safe the environment is for a patient. We know in our state that we have had to grapple with racial disparities when it comes to birthing outcomes. We have maternal mortality rates that we are confronting as we speak. There's a maternal mortality task force that has been dealing with implicit bias training and how can we dismantle systemic racism in our medical system. And so this is part of that work, and continuing to do public engagement and public education around individuals' birthing options, and also making sure that they know there's a lot of different information out there. And so separating some fact from fiction and what the situation is really like on the ground, helping us understand it and then helping the public understand it. And then finally, we're also trying to better understand what effect COVID has on pregnant people, on newborns. And just, there's new medical information coming in every day. So the Department of Health is making a big effort to best understand that so we can act accordingly and make sure that everyone in a birth setting is safe and healthy. So with that, I'm almost to my half hour, so I'm going to close it up. But so that was a sample of just a few of the things that we've been working on in the governor's office to deal with the effects of COVID on women, and make sure that we are tackling all of these different issues. As I mentioned, there's a lot of different competing priorities. There is so much happening simultaneously right now. It feels like the house is on fire and we're trying to put it out and then also build the house at the same time. Like there's a lot happening. But one thing I really want to leave you all with is how important it is that you continue to raise your voice on the issues that matter most to you. The government does not stop working because we are in the middle of a major crisis. And so that is the biggest thing that I can pass along to you all, is that we're dealing with a lot of different issues right now. And I hope that you continue to advocate for what you believe in, and continue to make sure that we are paying attention to what is happening on the ground, because you know that best. You are the people who are the leaders in your community, on your campuses. So, be in touch. This is my contact information. And with that, I'm going to stop the share, and then Taryn or anyone else wants to take over, we're We're good.
Yes, Emily, this is Austin Ostra. I'm the president of the Student Assembly. I just wanted to take a moment to thank you so much for joining us tonight. I think the whole country has seen how lucky New York State is to have Governor Cuomo's leadership. And we know that that leadership in this crisis is only made possible by the work of an incredible staff, which you're an integral part of. I also wanted to recognize Aloi Tisor, who I know is on the call, who served on our Student Assembly Executive Committee last year. And it's great to see the great things Aloi is already doing post-SUNY. So thank you, Aloi, for joining us. Thank you, Emily. And please extend our gratitude to the governor for everything he's doing to look out for students and for our state overall.
Great. Thank you so much. I really appreciate that. And yes, thank you to Aloi, who both set this up, but who's also an integral part of the Women's Affairs team and the domestic violence prevention team, and is just an amazing leader in our government. So thank you.
Thank you so much, Emily. Take care.
Bye.